So welcome, this is Dr. John Kojis. I'm here today with my friend and colleague Heidi Linden. Welcome, Heidi.
Thank you very much, John.
Heidi is an acupuncturist and a Chinese herbalist, practices on the east side in Portland. She does some very interesting things that I wanted to ask her about today, but Heidi, if you would, why don't you just give me a little broad brush sketch of what it is you do in your office?
Well, I really love doing family care. So I treat everyone from very young pediatric patients all the way up through any sort of family issues, and then to serious and debilitating diseases such as cancer. So it's a fairly wide range that I work with.
So I think we talked earlier, you were telling me you part of the diagnosis that you do has something to do with reading people's faces.
Yes.
Tell me about that. How did you get into that?
Well, actually, I was born with a very strange skill of seeing illness in people's faces. And I think I would shock my parents sometimes, explaining how someone was sick, and I thought they would see it too. And I'd be very worried about someone, but I wouldn't know why. And it wasn't until I actually went to Chinese medicine school and started translating the old classic medical books that are about 2,500 years old. They have entire chapters in there about medical facial diagnosis. So through those translations, I was able to actually begin to interpret what I was seeing and really understand the illnesses that I was seeing so I could really help people do it.
So how would that work? Let's say I came to see you and my nose won't quit dripping and I've got something green growing on my shoulder. You know. Can you help me with that?
Green shoulders, we can help.
Where would you start? What would be the...
Well, facial diagnosis is one aspect of a much larger diagnosis. So
Okay.
Chinese medicine diagnosis takes a lot of things into consideration, face being one of a very ancient high art, turns out. Because you're actually able, it's almost like having an MRI of the inside of your body right on your face. So that's pretty incredible. So I can't ever not use that, because the face is so available to all of us. So facial diagnosis is one thing. There are other forms of diagnosis, lots of questioning, palpation of the body, pulse taking. There are quite a number of forms of diagnosis in Chinese medicine.
And you look at someone's tongue, is that part of it?
Tongue is also a part of the diagnosis as well, yes.
Okay.
Yeah.
And so let's say you've figured out what my body is doing with this green shoulder and drippy nose thing. So how would you, what options do you have for treating someone in Chinese medicine? I kind of know, but perhaps not all of our audience is familiar.
Well, there are a lot of options, many more than acupuncture needles. Acupuncture needles is one option. Just doing acupuncture itself is incredible. And I've learned different systems of that. So there's the acupuncture that some people might be familiar with, which is maybe more of a Chinese system. And then I've also been trained in Japanese acupuncture. And oftentimes we're not inserting anything into the body. We're not even using a needle as you would think of it in your mind, but very other special tools that actually create just as much change and profound healing as the insertive needle. So I have to take that on a case-by-case basis, and it really depends on how the patient is presenting, how healthy or not healthy they are, what are they bringing to bear in the situation, how acute is their situation, what are their whole body needs. And so both Chinese and Japanese acupuncture would be some of my options, but also we have a lot of other tools in our toolkit to use. We have things like moxibustion and cupping and something called gua sha, which people in the chiropractic field might know of as the Graston technique.
Okay.
That's actually gua sha, and that's a folk medicine that everyone in Asia uses at home. So it's a great thing to teach your patients how to do as well, take it home with them. So many, many options. And also a gentle form of structural body work that I use called sotai, and that can also be very helpful for relieving serious pain, tremendous inflammation, people having had car accidents or structural abnormalities. Sotai can be very helpful as well.
Okay. Gua sha, is that the scraping with a coin thing?
Yes, a coin or some other sort of tool.
Okay.
Mm-hmm. Yeah, horn or a piece of jade, or there are many things. And actually, one of the best things to do at home is use a peanut butter jar lid. It's one of the best tools you could have.
Wash the peanut butter off first.
Please do, yes.
Okay. You were saying earlier that I'm really stuck on this face diagnosis
Yes.
thing. You said that sometimes it's something that you teach to the people you work with to help them help themselves. How might that
Oh,
work?
well, I do. I both teach at the Chinese medicine school sometimes. They get invited to lecture there. Colleagues oftentimes want to learn about this, so I'll be teaching colleagues how to do this and helping them understand what's in these books and all the techniques of doing it, what to look for. And then with patients, I have a mirror in my office, and when I'm noticing something, oftentimes they're really quite curious, and we go up to the mirror and we talk about if they can see what I'm seeing. So I want to make sure that they can actually observe, and over time they get really good at this, and they get very, very curious. And so it really helps patients actually stay really devoted to their treatments and their lifestyle plans, because they know when something happens that they're not making good choices, it will start to show up in the face. So
Wow.
it's an incredible way for a patient to monitor themselves.
Oh,
And they
good
start
feedback.
treating themselves better.
Oh, interesting.
It is very interesting. Yeah, I had no idea that would really happen when I started teaching patients this, but it's a great tool.
And so you're kind of sort of an expert in this, it sounds like, in terms of teaching other people and writing a book about it.
Well, I guess it turns out to be so. It's very rarely used now in modern Chinese medicine. It's sort of fallen by the wayside, and it really needs to be unearthed, because I didn't know this, but it was considered one of the highest forms of diagnosis that you could have. And so I'm trying to unearth this very old thing that everyone has at their fingertips, and it's a very powerful diagnostic tool. You don't need to get a whole body radiation scan. Sometimes I can see right there what's going on.
Very cool.
Yeah.
Let me ask you this, Heidi. This is kind of the question I ask everyone here.
Okay.
If you could come up with a single piece of advice for people who are looking to support their own health, if there was just one thing you could tell them,
Oh.
this is it,
Okay.
what would you say to them?
I think the most important thing is to realize that your symptoms are actually your body communicating with you, and your symptoms are not to be ignored, whatever they are. That doesn't mean you have to walk around being a hypochondriac, but in our culture we tend to want to just take a pill or do something to mask a symptom, but the symptoms are actually telling you what's going on in your body. And so I think the best way you could care for yourself is to be willing and to learn how to pay attention and not to ignore yourself.
Very nice. Well, thank you very much. That's good. I agree to that.
Thank you.
Well, thank you for joining us here today, Heidi. I hope it was fun for you. Is there anything else you want to say to the people?
It's been a great pleasure, and those of you who haven't tried Chinese medicine, it might be worth a go. There's a lot we could offer in so many ways.